Father, thank you for today. Thank you for enabling us all to be here. This responsibility we have to provide health services for our people. We're thankful for the resources that you've given to us, and we trust that we will be good stewards of your resources. Thank you again for this time, this dedicated time. In Jesus' name, amen. Amen. Shelley, could you do the roll call?
Yes, sir. Mike Dobbins.
Here.
Dora Petzkowski. Here. Keith Austin. Here. Danny Callison. Here. Julia Coates. Here. Sean Crittenden. Joe Deere. Rex Jordan. Here. Johnny Kidwell. Here. Darrell Legg. Wes Snowfire. Here. Joshua Sam. Here. Mike Shambaugh. Here. Melvina Shotpouch. E.O. Smith. Here. Condessa Teehee. Victoria Vasquez. We have a quorum.
Thanks, Shelley. I would entertain a motion to approve the minutes. I hear a second. Second. All those in favor? Aye. Motion approves. On to reports. Claremore Service Unit, Mr. George Valier. Afternoon, George.
Good afternoon. Well, you have my report there. We're doing well, visits going well, collections going well. One of the things I wanted to bring up, and we have a nurse consultant, a legal consultant there at the hospital for the next 8 to 12 weeks, going over documentation in the chart for the nurses, for the docs, making sure everything's on the up and up. That kind of goes hand in hand with the, we're also in our window for survey. We are still surveyed by Joint Commission, and we are in that window from now till mid-December, so we can expect them to come in any day. Through COVID, they got behind on a lot of things and were running late. I am told that Joint Commission has made up all that lost time, and they are current on their surveys, so we can expect them anytime between now and the end of the year. But that we brought the nurse legal consultant in to help go over our documentation and make sure everything was good. The last thing is kind of a neat deal I wanted to go over. I forgot about it last time because I left my pill bottle in my pocket. We've started our pharmacy in the last year has started a new here, I'll pass that around. You guys can look at it. There's a QR code there's a QR code on the side of that. Every bottle that leaves our pharmacy has that QR code on it. Patient can scan that on their phone, and it will pull up videos that tell the patient all about that medication, how it's used, contraindications, warnings, anything about that medication. So if you go in and you get your refills and say you've got 10 medications you get, each one of those medications will have a QR code for that specific medication. That's really been well received by the patients. And we've been doing that for about a year, and I want to get that up and share that. But that's gone real well. Any questions?
Questions for George? Keith?
Is that IHS wide or just a Claremore thing?
Claremore.
Really?
Yes, sir.
It sounds like something that a lot of people should adopt.
We have a combined meeting in August that we're gonna roll that out and share it with everybody else.
Well, I applaud you for that. Your team deserves credit.
I'm not sure whether our pharmacies adopted that or not. I'm not aware of it, if we have. Yeah. Any other have questions for George? I just had one, just a dental question. Again, George, you may not know the answer to this on Page 5, it describes a hygiene outreach visit. Do you know what that means, dental hygiene outreach visit? Page, well, it'll be
I will,
2.
I'll put that down and I'll find out for you.
Okay. I had not quite seen that before. Okay. Want to compliment you too, George, on your report. It's very extensive, complete. Appreciate it very much. We appreciate you coming in on a holiday. This is
Oh,
your
no problem,
holiday day.
no problem.
George is on
No problem.
doing duty here. All right. You get time and a half today, right?
Yeah.
All right. Okay, thank you, George. Up next, Cherokee Nation Health Services. I believe we have a pinch hitter today for Dr. Jones, Mr. Brian Hale.
Few highlights. This is not on the highlights packet, but I did want to include it. We have actually started performing inpatient dialysis at Hastings Hospital, which is a big step forward for us as far as our inpatient capability. That is for patients that are admitted to the hospital only. We continue to have patients go to other outpatient services for outpatient dialysis, but that is a big step forward. Appreciate the team at Hastings that made that happen. Also, week before last, we had our family medicine residency graduation. We graduated 4 family medicine residents. That program continues to grow and be successful. We're very proud of the work that Dr. Beck does for our family medicine residents. You can also see we had a new employee orientation has gone to virtual options for some of our health centers out on the reservation. Had a site visit for our vaccine for children's program. No nonconformities, and they noted that we have not lost any vaccines. So team does a really good job of tracking those vaccines to make sure we make the most of those. Happy to answer any other questions that you all may have for us.
Questions for Mr. Hale? You mentioned real quickly the residency graduation we had here about 10 days ago. Had 4. And did we have 2 that have decided to stay with us?
That is correct.
Okay, the residency is a young person normally graduates undergrad from a university, then the 4 years of medical school, then the 3 years of residency on top of the medical school, and that's what we observed, that student that graduated that 7th year in their medical training, and now they're ready to be a doctor.
That's correct.
And 2 of the 4 are staying with us. How many residents do we have in training on our campus, do you know?
There are 3 different cohorts for those 3
Yeah.
different years, and I want to say the newest cohorts are up to 6 to 8 residents per class. So
Yeah.
we have just recently in the last year expanded those. So but
Yeah.
it takes a little bit of time for those to
Yeah.
grow.
Okay. Mike?
Not really a question, but just a comment. Boy, that's a big deal with dialysis.
Yes.
That's a monster deal, especially how prevalent it is. And, I know that some people come in there with really, really high sugar rates when things go wrong. And, boy, that's going to be a plus for us to take care of our own people and not have to send some of them out.
We're very
Yes.
excited to have this new capacity.
I bet. We are too. All right. Thank you, sir.
I saw where the CDC recognized us for our Hep C program. Care to comment on that, or?
Yes, we had some of our, Dr. Mira and Whitney in our infectious disease clinic. They were recently published in the CDC's morbidity mortality weekly report for their work on hepatitis C. They were published just highlighting the success that we've had in eliminating hepatitis C on the reservation.
Yeah, that's a big deal.
Very prestigious.
Yeah, big deal. No more questions for Brian? Okay, thank you, Brian.
Thank you.
Public Health, Ms. Lisa Pivek. Hi, Lisa.
Hello, how are you
Very-
today? Thank you for having me. So I have a few highlights off the report that you have. One that I wanted to mention right away is a big thank you to Education, Lisa Trice-Turtle, and Government Relations, Kim Teehee, who partnered with Public Health to do the Know Your Nation Youth Summit. It was very successful, had 80 to 100 kids and a great all-day presentations and work that they did, so really happy about that. The second thing is that we've received several new grants over the last couple months since I've seen you. One of them is the School Health Grant, and it's got a really long title. It's on your report. School-based interventions to promote equity and improve health, academic achievement, and well-being of students. Cherokee Nation was awarded that funding. We are the only tribe in the nation who received that funding. The other recipients are either states or universities. And that is also, we are collaborating with Education and Immersion for that particular initiative. One of the other ones that I wanted to highlight, WIC has received several. The one I want to highlight is the Community Innovation and Outreach from USDA, which is a very prestigious one as well. We were funded the most money of any of the applicants, and it is to do quality improvement on WIC and increase your participation in WIC across the service area. And so we'll be launching that one pretty quickly. The other thing I wanted to mention is, I think a couple of months ago, I told you that we received funding for a wastewater surveillance system, and we are building that right now. It is collaboration with environmental programs and health services, and it has much more utility than just beyond, you've probably heard it in relationship to COVID-19, but it has other abilities as well to be able to track other things in the water source and be able to identify trends. So we're excited about getting that going. Our reaccreditation site visit finally is here, July 27th for public health, our reaccreditation. Excited about that. And the last thing I will mention is that WIC has started handing out the farmers market vouchers. This is the first year we've had a farmers market program for WIC. They're also recruiting farmers. And so if you have someone call you and say, hey, someone was out here trying to get me to sign up to be a farmer, it's legitimate. I've had a few calls from folks who said, is this real, or are you really looking for vendors? And yes, we are. We're looking for farmers. We want to be able to use it at farmers markets, but we also want our participants to have the ability, if there's a roadside stand or a farmer somewhere, to be able to utilize them there as well. So we're doing that. The other highlight, I would say, is that we're also moving to, WIC received funding, and we're moving to the electronic benefits for farmers market as well. So this will be the last time, the only time we'll have to hand out vouchers is this particular year. And as far as the summer EBT program going, I don't know if you noticed the numbers, but we were increased by over 2,000 participants this year for SEBTC, which is the summer feed program for children. So I'm very pleased with that. Other than that, I'm happy to answer any questions that you might have.
Questions for Lisa? Wes?
Hey, I just want to say I'm glad to hear about the farmer's market voucher for the program that you guys got involved in, and just really appreciate you jumping on that one. I know that was a kind of unique opportunity to be able to go get, so I'm glad you got that, and I'm glad to see that it's working well. So just want to say thank you. Appreciate it. Appreciate it, Mike.
Okay. Any other questions for Lisa? Just a brief question on under our tobacco cessation program. I noticed we've gone to the Gospel Rescue Mission. Be page 5 of 15 on your report. Is that something we've been involved with in the past, going to Gospel Rescue Mission? That's in Muskogee.
Probably, no, it's a new, we've
Yeah.
been expanding out our opportunities for cessation events to more community. After the one, we're finally back out in the communities after the pandemic, we're trying to expand out and look at unique ways to reach citizens in different places, so.
So is that offered to non-tribal citizens, tobacco cessation?
You can come to the cessation classes, yes, now, because we don't distribute out any cessation pharmaceuticals of any kind.
Yeah.
So they can come, and mainly you have to have, especially if you have a spouse or someone in the family, it's really almost impossible if you have two people to not have them both involved. But, as far as our ability to have people in classes, that's free and open, yeah.
Okay. Yeah. I see no more questions, Lisa. Thank you. Thank you for your report, too. It's very thorough.
Thank you.
Very thorough. Okay, I see no old business pending, no new business. Are there any announcements? We're not very curious today. That's okay. I'll entertain a motion to adjourn. Second. All those in favor? We are adjourned.